Causes and Consequences of Anemia Among Children Under Age 5, a Scientific Overview. General overview: anemia in children under the age of 5 is a pervasive global health issue with substantial implications for child development and well-being. This scientific note reviews the primary causes and consequences of anemia in this vulnerable population, emphasizing the need for comprehensive public health strategies to address this preventable condition. Introduction: anemia among children under age 5 is a widespread health concern, particularly in resource-limited settings. This scientific note aims to provide an overview of the causes and consequences of anemia in this age group, highlighting the critical importance of early identification and intervention. Causes of anemia among children under age 5. Nutritional deficiencies. Iron deficiency. Inadequate dietary iron intake is a primary contributor to childhood anemia, hindering hemoglobin production. Vitamin B12 and folate deficiency. Insufficient intake of vitamin B12 and folate can impede red blood cell formation, leading to anemia. Infectious diseases, malaria, parasitic infections, particularly malaria, can cause hemolysis and reduce the lifespan of red blood cells, contributing to anemia. Hookworm infection. Intestinal parasites such as hookworms can lead to chronic blood loss, exacerbating iron deficiency anemia. Inflammatory conditions, chronic infections, prolonged infections such as HIV or tuberculosis can contribute to anemia through inflammation and increased demand for nutrients. Consequences of anemia. Among children under age 5, impaired cognitive development. Anemia during early childhood is associated with cognitive deficits, affecting learning and intellectual capabilities. Increased susceptibility to infections. Anemic children are more vulnerable to infections, leading to a vicious cycle of illness and malnutrition. Growth retardation. Chronic anemia can stunt physical growth and delay the development of motor skills in young children. Increased mortality risk. Severe anemia is a significant risk factor for mortality among children under age 5, particularly in the presence of other health challenges. Prevention and intervention. Micronutrient. Supplementation. Targeted supplementation of iron, vitamin B12, and folate can address nutritional deficiencies and prevent anemia. Malaria control programs. Efforts to prevent and treat malaria, including the use of insecticide, treated bed nets, and anti-malarial medications, are crucial in anemic-prone regions. Hygiene and sanitation initiatives. Addressing parasitic infections through improved sanitation and hygiene practices can mitigate the risk of anemia. General recommendation: anemia among children under age 5 is a multifaceted challenge with far-reaching consequences for health and development. Comprehensive strategies encompassing nutritional interventions, infectious disease control, and public health initiatives are essential to reducing the burden of anemia in this vulnerable population and ensuring optimal child health outcomes.